about gonadotropin and gonadotropin releasing hormone related drugs and the conditions. So next, coming to the gonadotropins and gonadotropin releasing hormones. So gonadotropin releasing hormones can be used as the agonist as well as the antagonist. So we need to understand what happens with their agonistic action as well as the antagonistic action, where they are used, are there any side effects, and if it is given through agonistic route, if you are giving it through pulsatile and non-pulsatile manner. So what happens? So pulsatile means you are giving every 90 minutes, Non-pulsatile means once in a day. So let us see here. So if this gonadotropin releasing hormone agonist is taken and if it is given in a pulsatile manner, that means it is administered every 90 minutes here, and non-pulsatile means it will be given daily once. So what happens? So if it is given in a pulsatile manner, please remember here, you can see there is an increase in the LH and the FSH. Follicle stimulating hormone and the luteinizing hormone will be increased. So this in turn will lead to increase in the sex hormones. So increase in the estrogen, progesterone as well as the testosterone. So this activity can be made utilized where? In case of the infertility conditions like anovulatory infertility, if there is a delayed puberty, also in case of hypogonadotropic hypogonadism, and also in the cryptorchidism. So there are 4 uses. One is the anovulatory infertility, second one is the delayed puberty, and third one is the hypogonadotropic hypogonadism, and fourth use is the cryptorchidism. So this is the uses when GnRH agonist is used in the pulsatile manner. So this is very important. Again, these has been asked in your exams many times. So pulsatile manner, where you want to use. So it is used in case of infertility, delayed puberty, hypogonadotropic hypogonadism as well as the cryptorchism. So thereby you are increasing the LH and thereby increasing the sex hormone production. So what happens if you administer a GnRH in a non-pulsatile manner? So non-pulsatile manner means you can see it is given daily. It is not administered frequently. So in case of non-pulsatile manner, so what will happen is, here you can see there is a decrease in the LH and the FSH secretion, which in turn lead to decrease in the sex hormone production. So there will be decrease in estrogen, progesterone as well as the testosterone, and where we can use these. So decrease in the sex hormone production is required in case of the, it can be remembered as PF end is precious. PF end is public provident fund is very precious at the end. It can be remembered as prostate carcinoma. P, F stands for fibroids. N stands for endometriosis. Precious stands for precocious puberty. And next, also in case of PCOD, polycystic ovarian disorders. So the mnemonic here, what you need to remember is the PF end is precious. P stands for prostatic cancer. F stands for the fibroids. N stands for endometriosis, and the precious stands for precocious puberty as well as the next P stands for PCOD. So in these conditions, you need to give a non-pulsatile nature of the drug has to be given. So GnRH agonist will be given in a non-pulsatile way. So next, coming to the antagonist, GnRH antagonist. So here GnRH antagonist will directly produce a decrease in the LH and the FSH. As you can see here. So it will be similar to that of the GnRH agonist when it is given in a non-pulsatile manner. Very important. Again, these use has been asked many times in your examinations. Please remember this mnemonic so that you can answer it correctly. So next, that is the GnRH antagonist. It decreases the LH and FSH levels. In turn, they decreases the sex hormones. Where it can be used, it's similar to that of the GnRH agonist when it is used in non-pulsatile way. They are used in prostatic carcinoma, endometriosis, etc. Please remember, in case of precocious puberty, the GnRH agonist in a non-pulsatile manner, it is a drug of choice. We'll also see what happens when synthetic gonadotropin releasing hormone is injected. So, are there any